Hello, this is Hammad from ASH 2024. I would like to talk about our study on myelodysplastic neoplasm with TP53 mutation. So this is very well known that these patients have a very poor prognosis. So that's why it was introduced in 2022 in the classification of the 2022. So we have two classification systems that were released in 2022, the WHO and the ICC. So the problem is that they have different criteria for classification. The ICC have two entities for this MDS with myelodysplastic neoplasm with TP53 mutation, while WHO lumped them all into one entity. And in addition, the complex karyotype can be used as a substitute marker for the double hit, because these patients typically have double hit TP53 mutation. So basically, our goal of this study is to study the differences and assess the different key analysis. So basically, we classified the patient into monoallelic and biallelic patients, and therapy-related and non-therapy related. And we classified them based on the WHO and ICC. We identified about 330 cases. And we selected a subset. We call them bona fide biallelic TP53 mutation. Those patients, they meet both the WHO and ICC criteria. So we sort of use them as a control to compare the survival and as a sort of a control, yeah. So basically, the overall survival, we found that monoallelic have a longer survival than biallelic. This is like a validation of previously known finding. Therapy-related have a tendency toward shorter survival and statistically significant. What is interesting and also validated by other studies, transplant seems to be improving survival significantly, as you can see here, the wide separation between the survival curve. Now, the classification impact, which is basically the goal of this study. So we identified a subset of cases where we can classify them into this entity based only by using the ICC criteria. And we compared them to the subset of cases, we call them bona fide biallelic TP53 mutation, to basically see the survival differences. There was a trend toward longer survival in ICC, but it was not significantly different. And what is interesting also, we found a subset were defined by WHO as MDS with low blast. This is basically a low-risk disease, so it was surprised that we found some subset of cases that would fit into myelodysplastic, but by ICC would be classified as MDS with TP53 mutation. Importantly, we found that those were classified by the WHO have a survival curve very similar to the bona fide biallelic TP53 mutated cases, indicating that those patients are not really low-risk disease, they have a high-risk disease. Finally, as I mentioned earlier, ICC classified them into two entities, MDS with TP53 mutation and MDS AML. So basically, we wanted to see if MDS AML would behave worse. That was one of the main things what we wanted to assess. So we compared them to the other biallelic cases. We found there is no significant difference in terms of survival, suggesting that patients with lower blast counts behave similarly poor to with higher blast count, more than 10%. So in conclusion, the classification, the distinct categorization by ICC into MDS and MDS/AML could be aligned with the WHO because they both behave poorly. And also the subset of cases that were classified as MDS with low blast could potentially be aligned with the ICC and could be classified into this entity, given that they have a very poor prognosis. And finally, and we sort of validated what was previously published, the importance of the significance of hematopoietic stem cell transplantation in those patients.